Next, we'll hear from Maryland's oral health leader, Dr. Harry Goodman.
Thank you very much, Dr. Hughes. I didn't have any prepared comments, but I'm very, very thrilled to be here. Once again, despite the budget that we're in, the stars continue to align. Prince George's County, of course, is where it all probably began in terms of the reforms that have taken place in Maryland after the untimely death of Diamante Driver in February of 2007. And I actually, the reporter who actually wrote that first story in the Washington Post this year, and I'd like to recognize her because she's been so amazing, and she just didn't convey the statistics. There was passion behind it, and I think that story is the reason why we're, in many ways, we're all here today. I just want to recognize Mary Otto. If you could stand up, Mary, from the Washington Post. Thank you, Mary. Because these stars are aligned, I think Maryland is in the process of becoming a model for the country. We received an A from the Pew Grant Foundation, and we were told by Pew that if the report card had been done maybe even 3 years ago, we would have received an F. We've made tremendous strides in our Medicaid program, where many more dentists are now providing care. We're not completely there yet. We still got more to go, but thanks to our Medicaid programs, the DentaQuest company that has taken on the dental project for the Medicaid program, the program now is attracting many more dentists. The rates are a lot better, and it's made it a lot easier for dentists to participate in the program, and that's really, really important. We've also expanded our public health infrastructure, and of course this is another piece of that, even though I can't take credit for it, but I think it all gets leveraged together and everything kind of adds to the other. And as we have such great momentum here in Maryland, that when people hear Maryland now, there's sort of an attraction to get resources. We're all about partnerships. Everybody you see up here today has been just tremendous in terms of what their recognition of dental as a big issue in our state, and their willingness to step up to the plate and provide services. So we've done a lot of things, but there's a lot more to go, and there's a couple of very exciting things on the horizon this next year. One is that we're going to be embarking upon a big dental education campaign in the state. It's going to be in all media, whether it be social media, traditional media, TV, radio, and what we're going to be trying to convey the message is that dental health is important for overall health. It's important to go to the dentist. It's important to go to the dentist on a routine basis. It's important also to brush your teeth and to eat the right foods, but not just to convey those facts, but to convey it in a way that people totally understand it, so that they can change behaviors. That's what we're going for. It's called a literacy campaign, not just an education campaign, and we really feel it's important because as I told Mary in the wonderful article she wrote the other day, Diamante Driver wasn't just failed by the lack of not having a dentist. That's just the end part of that whole paradigm. He was failed because he didn't have exposure to education that we know works in preventing oral disease, and also preventive services. And that there was nobody coming into schools and looking in his mouth and saying, there's a problem, we need to kind of get you into care. We didn't have that system in place because oral health was not valued. We need to value it, and that's what this campaign is going to do. And it's all going to culminate in a big summit at the end of this year, and where a lot of this is going to come in, and we hope that a lot of folks in this room will be present at that summit to discuss how Maryland moves forward, not just from where we came to where we are, but we need to continue to move forward. So it's really, really important. So I'm incredibly honored. I love Debony Hughes. I've known Debony for many years. And this is a great health department, and she's really built this program up and is seeing Medicaid kids, and I can't say enough about her. So again, I'm honored to be here, and thank you very much for being here.
Now I'm pleased to introduce Mr. Mark Luckner. He is the Executive Director of the Maryland Department of Health and Mental Hygiene's Maryland Community Health Resources Commission.
You're a tough act to follow, Dr. Goodman. I'll keep my remarks brief. Mark Luckner with the Maryland Community Health Resources Commission. I'd like to thank Dr. Hughes for inviting me to be here today. It's a high honor, and it's very humbling to be on this stage with Dr. Schell and Dr. Goodman and everyone here. It's a lot of work to do to expand the public health infrastructure here in Prince George's County in the state. I'm a small state agency. We've been around for about 5 years, and we've given out about 78 grants, $21.6 million. And far more important than the money we've given out are the people that we've served. Those 78 grants have served 82,000 Marylanders. A good chunk, almost 25% of our awards have gone to serve dental programs. We're delighted to support this program. We're delighted to support other programs here in the Prince George's County, the partnership with Dimensions Hospital, partnerships with Greater Baden, and the whole array of dynamic and meaningful programs that Dr. Schell has pulled together. It's a wonderful partnership that we have with the Prince George's Health Department and with Dr. Hughes and all of the staff of the Prince George's Health Department, and in particular, Dr. Goodman had talked about, not where we've been, but where we're going. And we are excited to work with County Executive Baker. Under his leadership, he's going to move healthcare forward in Prince George's County, and I would be delighted to support those efforts. Thank you for inviting me to be here today.
Thank you so much. Now I am so pleased to introduce the Dean of my alma mater, Howard University College of Dentistry, Dr. Leo Rouse.
Dr. Hughes, thank you very much. Good morning, everyone. Good morning. This is a great day, and it's great to be in my county. Even though I'm across the board at Howard University, it's good to see you here this morning. I'm very proud of Dr. Hughes and our partnership with Howard University. You met my residents, my department chair. This is all about children. It's about education. If you recall about 2001, Dr. David Satcher, former Surgeon General, published America's first document on oral health in America. And that document focused on a lot of good things, but dental caries in children, but more importantly, literacy, and the effect that poor oral health in kids have on education. So to see the young man here this morning, other representatives from the poster contest, it's about education, it's about learning, it's about the future. Dr. Goodman and others, Dr. Schell, they have been great partners for the university. But my role this morning is to talk to the parents and the kids about it's good to know that good teeth lead to smart children. It's good to know that that adds to the component of learning. The STEM subjects, science, technology, engineering, and math. To have a child in the classroom with dental neglect, dental disease, he or she's not learning. I'm all about education. I'm all about the kids because one of these kids is going to replace me one day as Dean at Howard University. It's about legacy. It's so important to me. But Dr. Hughes, I want to again commend you for your due diligence. And I mean, she's tenacious. She stayed on me to make sure we were here. She said, you live here, you need to be here. And we are here. And I'm so proud of my residents and my department chair, Dr. Thomas, and all the Howard alum that give back to this wonderful county. So to the parents, I thank you. Remember now, Harry said it, oral health is part of total health. And tied to that, oral health lends itself to a very bright, talented young child. And that's so important. So I wish you a great day. But Dr. Hughes, again, I'm vertical today. I'm doing well. I had surgery a few months ago. She said, you got to come. I will be there. I will be there. This is my passion, and I love this county, what we do, and thank you so very much for your support of this program. Have a good day.
Thank you so much, Dr. Rouse.